Hey guys, what's up? Hope you all are doing well. So let's start our today's video without any delay.
Click on Zombie Apocalypse.
Cataract. What does it mean? It is clouding of the lens or any opacity within the lens which leads to decrease in vision. Lens. It is a biconcave, non-vascular and transparent structure present behind the iris, dividing the eye into anterior and the posterior segments. It is held in its position by ciliary body with the help of suspensory ligaments known as zonule of Jenner. Coming on to its anatomy, the lens is covered by a structure known as capsule. Anteriorly, beneath the capsule, there is epithelium known as anterior epithelium, which is absent posteriorly, followed by there is cortex and the nucleus. The cortex consists of newly formed lens fibrils and the nucleus consists of older fibers. It consists of 64% of water, 35% protein and 1% of carbohydrate, lipids and other trace elements. Risk factors include increasing age, diabetes, obesity, exposure to excessive sunlight and UV rays, excessive consumption of alcohol, smoking, high blood pressure, previous eye surgeries, corticosteroids, excessive usage, previous trauma and nutrient deficiency. It may be congenital, age-related, metabolic, drug-induced, traumatic and inflammatory and other disease associated. Pathogenesis. In systemic diseases like diabetes mellitus, there is increasing glucose level. As a result, there is increased hydration of lens leading to its opacification. And in other ocular diseases like retinitis pigmentosa, uveitis, acute congestive angle-closed glaucoma, as the age increases or due to increased exposure to UV light and radiation, there is denaturation of crystalline proteins in the lens, leading to its opacification. Classification. Based on its morphology, it may be subcapsular cataract, nuclear cataract, cortical cataract, or polar cataract. Based on degree of maturity, it may be immature, mature, and the hypermature type of cataract. Stages of maturation. Initially, it starts as a laminar separation, then incipient cataract, which may be a cuneiform or a cupliform, immature cataract, mature cataract, and hypermature cataract, which may be a Morgagnian cataract or sclerotic type. Difference between immature and mature cataract. In immature cataract, visual acuity is reduced to counting fingers, and in mature, it is reduced to hand movements or perception of light. In immature, lens is partially opaque, grayish white in color. In mature, it is pearly white in color. In immature, iris shadow is seen. In mature, iris shadow is absent. In immature, fundus may be visible. In mature, fundus is not visible. Clinical symptoms include painless, diminution of vision, difficulty in night vision, sensitivity to light and glare, halos around the light, frequent change in eyeglass prescription, diplopia or polyopia, color shift leading to yellowing of colors. Diagnosis includes visual acuity testing, slit lamp examination and retinal examination. Management. Non-surgical management includes treatment of underlying cause like control of diabetes, removal of cataractogenic drugs like corticosteroids and strong myotics, removal of irradiation, early treatment of ocular diseases like uveitis, delaying the progression by using iodide salts of calcium and potassium, and vitamin E and aspirin. Measures to improve vision in incipient or immature cataract stage. Prescription of glasses for refractive status, using of dark goggles and mydriatics. Surgical management includes two types of procedures, one ECCE and another ICCE. ICCE, intracapsular cataract extraction. In this, a large incision is made in the cornea and entire lens along with the posterior capsule are removed and glasses are prescribed for the aphakic eye. This method is no longer followed. ECCE, extracapsular cataract extraction. It is a procedure where anterior capsule, epithelium, cortex and the nucleus are removed, sparing the posterior capsule on which the artificial lens is placed. This procedure is of three types. Conventional ECCE, where a large incision is made in cornea and the procedure is done. SICS, small incision cataract surgery, where a very small incision of about 3 to 5 mm is made in the cornea and the procedure is followed. And the third one, phacoemulsification, where a phaco machine is used which cuts the lens into small parts and then sucks it out. These are the steps involved in phacoemulsification. After each of these procedures, an intraocular lens is placed, which may be an anterior chambered lens, posterior chambered lens or iris supported lens. These are some types of intraocular lens. Hope you have liked this video. Please do like, share and subscribe if you find this informative, and also follow my Insta handle. See you in the next video.